Mental health affects every aspect of our lives, from relationships and work performance to physical well being and overall life satisfaction. Despite this, mental health has long been treated as a secondary concern in both healthcare and public discourse. For decades, stigma has silenced those suffering from anxiety, depression, PTSD, and other conditions, while lack of funding has left mental health services overwhelmed and inaccessible to many. But this is beginning to change. A growing movement is demanding that we treat mental health with the urgency, respect, and investment it deserves. The stigma surrounding mental illness is one of the most pervasive barriers to progress. For years, individuals experiencing mental health challenges were labeled weak, unstable, or dangerous. These outdated perceptions persist in many communities, cultures, and even healthcare systems. As a result, countless people suffer in silence, fearful of discrimination, judgment, or loss of employment. Stigma isolates those most in need and prevents early intervention, often exacerbating conditions to crisis levels. To break the stigma, public education is essential. Campaigns that normalize mental health discussions, such as "It's okay not to be okay" or "Talk about it," have been instrumental in creating safe spaces for dialogue. Celebrities, athletes, and influencers who speak openly about their struggles with depression, anxiety, bipolar disorder, and other conditions are helping reshape public attitudes. The more society sees mental health as a common, manageable part of human experience, the more likely people are to seek help without shame. However, destigmatization alone is not enough. Access to quality mental health care remains a massive challenge. In many countries, mental health services are underfunded, understaffed, and poorly integrated into broader healthcare systems. Wait times can stretch into months, especially for specialized care. In rural or low-income areas, services may be entirely unavailable. Even when help is available, the cost of therapy, medication, or rehabilitation is often prohibitive, particularly for those without insurance or stable employment. This gap in care highlights the urgent need for sustained, meaningful investment in mental health infrastructure. Governments must allocate funds to train more mental health professionals, expand community-based services, and increase the availability of affordable or free care. Schools, workplaces, and hospitals should have embedded mental health resources, not as an afterthought, but as an essential service. Evidence-based solutions already exist and can be scaled with proper funding. Cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, trauma-informed care, and peer support programs have been proven to reduce symptoms and improve outcomes. Teletherapy and digital platforms have also made care more accessible, particularly in underserved areas. Yet these programs often operate on shoestring budgets or are cut entirely during fiscal tightening. When governments and institutions invest in mental health, the return is not just emotional but economic. Improved mental health reduces workplace absenteeism, lowers healthcare costs, and enhances community resilience. Youth mental health requires particular attention. Rates of depression, anxiety, and suicide among young people have soared in recent years, exacerbated by social media pressures, academic stress, family instability, and global uncertainty. Schools must do more than offer occasional counseling. They need comprehensive mental health education, trained professionals, and proactive outreach. Early intervention is key, and investing in young people's mental health lays the groundwork for a healthier adult population. Mental health is also deeply intersectional. Experiences of trauma, discrimination, poverty, and systemic injustice can significantly impact mental well-being. Marginalized communities, especially people of color, LGBTQ+ individuals, refugees, and those with disabilities, often face unique barriers to care, including mistrust of the medical system and lack of culturally competent providers. Equity must be a central principle in all mental health funding and policy decisions. The COVID-19 pandemic further underscored the urgency of mental health care. The collective trauma of lockdowns, illness, grief, and economic disruption triggered a global mental health crisis. But it also brought mental health to the forefront of public policy and everyday conversations. Employers began offering mental health days, teletherapy services expanded rapidly, and governments began acknowledging the mental toll of the pandemic. We cannot afford to let this momentum fade. Now is the time to make long-term structural changes that protect mental health as a public good. Community involvement is crucial. Grassroots organizations, mutual aid groups, and local support networks often fill the gaps left by formal services. Funding these initiatives and collaborating with them can create more responsive, culturally grounded mental health support systems. Mental health first aid training, peer counseling, and accessible crisis lines are tools that every community should have at its disposal. Ultimately, mental health care should be a right, not a privilege. No one should be turned away from help because of where they live, what they earn, or who they are. Ending the stigma is about more than language. It is about changing systems. It requires courage from individuals, accountability from institutions, and a commitment from society to care for the whole person. Mental health matters every day for every person. It is not invisible and it is not secondary. It shapes our relationships, our productivity, our dreams, and our dignity. The time to act is now, not with platitudes, but with policies, not with silence, but with support. Because a mentally healthy society is a stronger, safer, and more compassionate society.